My name is Dr. Shikha Jain. I am an oncologist in Chicago at the Rush University Medical Center, and I subspecialize in GI malignancies. So, when you're immunocompromised, it means that your immune system isn't able to mount a response to infections such as viruses or bacteria that you might come into contact with. So, what that implies is that you are at a higher risk of getting infections. Someone who is not immunocompromised, when they face a bacterial infection such as pneumonia or a viral infection such as the flu, oftentimes their immune system can attack the foreign assault or attack the bacteria or virus that is affecting them and are able to get by with minor symptoms. When you're immunocompromised, that immune system response isn't always there and it's not as robust, meaning it's not as aggressive. And so, what that eventually can cause is for you to become much sicker than you would if your immune system was functioning the way it should. So, a history of cancer can increase your risk if you are undergoing current treatments, if you are on maintenance therapy, if you are dealing with a cancer that is a chronic illness. And also, it can impact your chance to getting COVID-19 if you recently completed treatment. So, being a patient with cancer can put you at higher risk. And even after you've completed treatment, for a certain amount of time, you may also continue to be at risk because of the nature of the way the medications and the treatments may have impacted your body. If you're on an oral agent, I think it's extremely important to try to remain as compliant as possible, meaning taking the medication as much as you possibly can, the way it's prescribed. It's also very important to stay in communication with your healthcare team. So if you are having side effects, if you're having complications, there's a lot of options for my chart visits and televisits and phone calls to the office just to keep them updated. It's really important to keep your healthcare team up to date on what's happening with you, because if you're on an oral medication and you need a modification of the dose because of the symptoms that you're having, your healthcare team can help you modify those doses to help your quality of life and help you feel better while you continue to take the medications. Oral agents can actually be a very useful way to be treated for cancer while decreasing the number of times you actually need to come into the clinic, thus exposing you to potential COVID-19 patients. So I strongly recommend, if you're able to be on an oral agent, try to continue with it, but make sure you're staying in constant communication with your healthcare team so they can help you manage any possible side effects or challenges that you're facing with the drug. COVID-19 has greatly altered the way that we advise many of our patients who are starting cancer therapy. It's extremely important to have a conversation with your oncologist and with your healthcare team to see if you are the type of patient who cancer therapy can be delayed. There are some treatments that are necessary to start urgently with certain cancers because the risk of not doing so could put you at extreme risk and actually result in the cancer getting significantly worse. There are some cancers where treatment can be delayed until the COVID-19 situation is stabilized and it's safer to go back in for regular visits. So there are absolutely some cancers where treatment can be delayed, but there are some cancers where treatment absolutely should not be delayed. And that is a conversation you need to have with your oncologist, because those types of decisions are made on a case by case basis. And it's very personalized to the patient as well as to the cancer type. As a survivor of cancer, there's a lot of screening and surveillance imaging and clinic visits that are often implemented. Currently, with the ongoing COVID-19 crisis, we have recommended that patients delay or cancel some of these not necessary or not urgent visits. This is, again, something that is extremely personalized and depends on the type of cancer and also depends on the patient and their risk for recurrence. Having these conversations with your oncologist and your entire healthcare team is essential in order to determine whether your clinic visits and your surveillance imaging is necessary or if it can be delayed until the COVID-19 situation is stabilized and it's safer to go back in for more regularly scheduled visits. To our cancer patients, just know that your team, your physicians, your social workers, your nurses, your MAs, we are all here for you. And it's our job and our goal to help you navigate this very, very challenging situation. We have drastically changed the way we take care of our cancer patients, but we still care very deeply to make sure that we provide you with the best, most evidence-based and up-to-date care, information, and guidance. So I strongly encourage all cancer patients out there to please, please keep the lines of communication with your healthcare team open. Talk to them, share your fears, share your anxieties, have discussions, and utilize your team to help you make decisions that are challenging to make. To caregivers of patients out there, it's incredibly important that you also utilize the healthcare team. This is a challenging time for everyone. And in order for us all to provide the best care we can to patients across the country, it's really important that we are open and communicate and we share our fears and we use science and evidence to make the decisions that we make.